Hi, my name is Alyssa Garrett, and my patient was a 16-year-old adolescent, and he was admitted to the hospital for major depressive disorder. His secondary diagnosis was his ADHD and autism spectrum disorder. He was admitted after making suicidal statements following an emotional outburst. What caused his emotional outburst at home was his parents taking away his technology, and when I was talking to him, he was stating that he felt like he lost his parents' trust. He also reported his urges to self-harm worsen when his technology is taken away, and that these suicidal thoughts and self-harm urges and emotional changes are consistent with his diagnosis of his major depressive disorder. For some signs and symptoms, the most important one is his suicidal ideation and increasing urge to self-harm. With major depressive disorder, changes in mood regulation and brain signaling can contribute to the feeling of his hopelessness and difficulty coping with the stressful situation of his technology getting taken away. For this patient, emotional distress at home appears to increase, and these thoughts and behaviors also tend to increase, and the urge to self-harm increases when he's at home. Another important symptom is his irritability and emotional outbursts. Depression in adolescence doesn't always present as obvious as sadness. It can present as increased irritability or like his self-harm urges and like uncontrollable emotional behavior. For the patho of major depressive disorder involves changes in how the brain regulates mood and stress and his emotions. Several neurotransmitters are involved, including the serotonin, norepinephrine, and dopamine. These neurotransmitters help regulate things like mood, motivation, pleasure, sleep, attention, and signaling and regulation of these symptoms can be altered when having major depressive disorder. Areas of the brain involved in the emotional regulation and decision making can also function differently. This can make it harder for a person to regulate negative emotions, like when he had his emotional outburst, and respond appropriate. And he doesn't respond as appropriately to stressful situations because his brain and the neurotransmitters aren't working properly. For this patient, these changes help explain why the stress at home of him getting his technology taken away by his parents led to the intense emotional outburst and the suicidal thoughts and the urges to self-harm increasing. And rather than just coping with it, it was difficult for him to cope with it and with the situation effectively because of the neurotransmitters not working as properly as they should. And then for patient-specific clinical reasoning, there are several factors that explain why his depression is presenting this way in the particular patient. He is 16 years old, and he also has autism spectrum disorder and ADHD. These conditions affect his emotional regulation and his impulse control, and along with his communication and how he responds to stressful situations. And he reported that his self-harm urges became worse when his technology was taken away. This suggests that the conflict or changes in his emotional routine may act as triggers of emotional escalation. He also stated that he feels that he has lost his parents' trust because he lives at home with his mother and his stepdad and 4 younger siblings, and his family relationships and home environment are especially important factors to consider with major depressive disorder, along with his ADHD and autism spectrum disorder. He also stated that he feels lost. He feels that that his second hospitalization got worse. So his reoccurrence of suicidal thoughts and self-harm behavior shows the importance of continuing to assess his safety and his coping mechanisms and his family support in response to the treatment that he's getting at the hospital. And then some of the medications that he is taking he is taking Amplify 5 milligrams every morning for his irritability, and he's taking Bactrim for his bilateral foot wounds, and then he's taking aripiprazole 5 milligrams every morning as well for his irritability. And he also takes Intunif and Quellbri for his ADHD. And then one important side effect to monitor for all of this is restlessness. These medicines can cause restlessness. This is especially important in a patient who already has agitation and suicidal or self-harm thoughts, because new restlessness or behavioral changes need to be recognized quickly with all of his emotions going on and his trying to control his emotional outbursts. And as the nurse, I would monitor his mood and his behavior and his suicidal thoughts. And if he is having any restlessness or any other changes to his demeanor after receiving the medication. Another PRN medication that he's taking is Benadryl. This is also for any sudden agitation or aggression that he has towards himself or any of the people around him. This is given to him as needed, 50 milligrams by mouth, and it has a sedating side effect, which can help decrease the agitation and aggression, and that is the reason why it's ordered for that purpose. And another important side effect is the drowsiness, and as the nurse, I would assess his level of agitation before administering the medication, along with his level of consciousness after receiving the medication. And then overall, the biggest concern in this patient is safety because of his suicidal thoughts and his increasing urge to self-harm. His behavior, his major depressive disorder, along with ADHD and autism, and all the family stressors and difficulty regulating his emotions can contribute to how he's currently presenting. And the nurses should focus on maintaining the safety of him and the people around him, along with assessing any changes of his suicidal ideation and self-harm urges, and identifying any triggers and helping him cope and helping him learn coping strategies to help him with his major depressive disorder, along with his autism and ADHD. So, yeah.